I don't think you have to be, an expert to understand that, even if people are in separate cells, these settings require people to share facilities like showers or microwaves or recreational space. Just exposes one person to what another person might be carrying, whether that's the flu, the cold, or COVID-19.
Monica Langarita is an immigrants' rights attorney at the ACLU. She's among many who have sounded alarms about how vulnerable people in detention are to COVID-19. In April, the ACLU filed a lawsuit to have at-risk immigrant detainees released from the detention center in Otay Mesa. They won the release of about 100 people, but are still fighting for more.
There's nothing forcing the federal government to detain anybody at Otay Mesa right now. Not one of these people are serving a sentence in connection with contact with the criminal system.
She's right to be worried. County of San Diego outbreak records obtained exclusively by KPBS show there have been more than 460 cases in the Otay Mesa Detention Center, which houses both ICE immigration detainees and prisoners for the U.S. Marshals. An ICE spokeswoman disputed that number, saying a total of just 200 detainees at the Otay Mesa facility have contracted the virus since the pandemic first struck in March. ICE does not report cases among its staff at the facility or U.S. Marshal prisoners. The Otay Mesa cases are among nearly 1,800 reported in jails and detention centers throughout San Diego County from March through December 18th, according to the records KPBS obtained. The records include numbers of cases at individual county jails, which the Sheriff's Department has refused to make public. Jails with the highest case counts are 149 cases at the George Bailey Detention Facility in Otay Mesa, 81 cases at the Vista Detention Facility, 59 cases at the South Bay Detention Facility in Chula Vista, and 43 cases at the downtown San Diego Central Jail.
3 of us were put into a cell together to be put back upstairs.
Jesse Cannon spent 2 days in the sheriff's downtown central jail at the beginning of November after being arrested for obstructing a police officer during a protest.
There's like half-eaten food everywhere. At that point, I noticed they had given one of the homies a mask, but they hadn't given all of us a mask. I asked for a mask, and they were like, "Oh, well, you're about to bail out."
This is not what's supposed to happen when people arrive at a sheriff's jail, says Lieutenant Kyle Bible, an assistant medical administrator for the department.
Starting with our patrol deputies. Our patrol deputies have masks that are spare in their trunk of their car, that before that contact even occurs at the street level, that arresting officer for the sheriff's department is actually providing a mask to that person in the event that they're coming into our custody. If for whatever reason that exchange never happened, before that arrestee even gets out of the car to start our booking process, our staff who are completely equipped in PPE will go out, and as part of their assessment, if that arrestee does not have a mask, one is provided to them.
In addition, he says holding cells are supposed to be cleaned after each new person is brought in, and new prisoners are tested for COVID-19 within hours of being brought into booking. Yet, even with these protocols, cases have surged at local jails. The KPBS records show more than 600 cases in county jails as of December 18th. Bible confirmed there had been outbreaks at individual jails and says one outbreak was caused when an inmate was moved from the George Bailey Detention Facility to the Vista Detention Facility.
The source of that outbreak is unknown. We did a very thorough contact tracing. And it was determined that the spread was a result of somebody that was asymptomatic. And that is what's so challenging in tracking this disease is you could have COVID-19 and bypass, a symptom review or a thermometer check.
Meanwhile, families of incarcerated people desperately search for information.
People will let us know that they have had outbreaks of COVID.
Layla Aziz, a criminal justice advocate at the nonprofit Pillars of the Community, says the lack of information leads to more mistrust of law enforcement in the community.
Families would be able to keep track of their loved ones. If we had transparency and we were able to a rapid response, a risk mitigation, something that should be built into our system, we were able to see we could stop the spread.
Claire Tregesser, KPBS News.